Good evening. Good evening.
Gustav, could you start?
Good evening, and thank you for choosing to make wellness and health your priority this evening. This is Medical Mondays with Dr. O, your interactive platform where we give you medical information and health information to help you make the best choice in life. Medical Mondays with Dr. O, it's not establishing a patient-doctor relationship, but rather giving you the relevant medical information from highly qualified practitioners in the field to help you make the best choice health-wise. This evening, we are discussing genetics and fertility with an expert in the field, Dr. Oluyemisi Famuyiwa. Dr. O, Dr. Toyin Okwesami, is a fellow of the American Academy of HIV, a family practitioner, and CEO of the Gennesaret Medical Center. Welcome, Dr. O.
Thank you so much. And welcome, everybody. Honorable Gustav, every week you just thrill me. So thank you. Thank you for all you do to make Medical Mondays what it is. Today we have Dr. Oluyemisi Famuyiwa, who is a fertility specialist. And guess what? I messed up the title of this topic today. It's actually genetics and fertility, like Honorable Gustav said, the seed or the soil. So I'm going to hand over the baton to Dr. Famuyiwa.
You are muted, Dr. Famuyiwa.
Yes, I was trying to unmute myself. Thank you so much for that generous introduction. I appreciate it. And as usual, I am very happy to be here. And it's such an honor and a pleasure. And it's fun. I think I've, made a few friends on the panel here. And I look forward to it myself every Monday. So the topic for today is, there's a lot of genetics when it comes to fertility. And I want to start bringing that up. When we refer to the seed or the soil, the seed being the embryo, the baby, the soil being the uterus or where the seed is implanted. So there are two parts to fertility. Do you have a good seed or do you have a good soil? Now, when people miscarry, it could be because the soil, the uterus, has recognized a bad seed and is simply spitting it out, right? So it doesn't necessarily mean that the soil has failed. Or conversely, it could be the soil is bad and is not receptive to a good seed, right? So tonight, I'm going to really deal more with the seed, not so much the soil. I think that will be a topic for another presentation because there's a lot to unpack in that. So let's talk about the seed, the embryo, the baby. The birds and the bees, where do babies come from, right? So most people, I'm going to show my screen if you guys don't mind me fumbling here. Okay, here we go. So we're going to talk about the genetics of fertility, specifically what makes up the embryo that goes into the soil, right? Most people know, I'm trying to forward the slide. There we go. So most people know that our DNA, what makes us humans versus horses versus plants, is in the genetic makeup, what's contained in our DNA. That DNA, usually see a double-stranded swirling mass, is contained in the nucleus of our cells. And we all have sets of this DNA in different, what is called, it's packaged differently in what is called the chromosome. The unique thing about human beings is we have 46 sets of chromosomes. We have half from our dad, half from our mother. That's just the way it's written. And this genetic DNA has to split because you can't combine mommy and daddy and combine 46 and get, 92 or something like that. You have to reduce it so that you can now rejoin it to make a new 46. And what we're going to talk about today is how does this come about? What goes into your mom and your dad's gene that results in you? And why are you not the same with your brother or your sister? Why do you have a different eye color, for instance, in a certain family? Of course, your environment does contribute to it, but a lot of it is written in your genetic makeup. So before you make an egg and a sperm, we have to take, they come from what is known as precursor cells. Those are the so-called progenitor cells that continually multiply to make more of themselves. Now, because this progenitor cells also contain 46 chromosomes, and they divide and still produce 46. And I'll explain how that happens. Right before they make a baby, they have to mature into a fully mature egg or a fully mature sperm. The unique thing with the sperm is the progenitor cells in sperm continues to divide so that you can continue to make more sperm. The progenitor cells for an egg, they stop dividing after a while. So then whatever you have at that point, when the gate closes, that's it. You don't make any more progenitor cells, okay? And those progenitor cells now mature and they unpack to become the fully mature egg. They divide, okay? The process of reducing the DNA content from 46 down to 23 is called meiosis. And when you now reduce it down to 23, you can combine it with sperm that is also 23, fertilize the eggs. This 23 sperm and this 23 DNA from the egg is now going to mix up to produce a new, brand new 46 embryo, which we call the zygote. And that is what now starts to grow rapidly to form the embryo, the baby, okay? So let me reduce this a little bit so I can see better. Shows, okay, I'm just trying to take the viewer thing off my screen so I can control this better, but I can't do it. All right. So how do you break this 46 original progenitor cell down to 23, right? That process is called meiosis. And a unique thing happens when you do that. The first is each pair. So let's say this is chromosome 1, right? And we know we have, 23 chromosomes doubled over to make 46. This original chromosome may have come from mommy. This original one may have come from daddy. This is the progenitor cells. What happens is this chromosome duplicates itself so that it now has two arms. So you see the two arms joined by this ball. It's necessary to produce two arms, and I'll show you why in a second. These two arms exchange genetic material. It's like there's something in the DNA that cuts the DNA, say here, and cuts it here, and moves this over here, and then cuts something over here and moves it over here. Think of it as before you make the egg, God is shuffling the cards. You know, when you play poker, you have to shuffle the cards. You don't just deal out the cards. You got to shuffle it up a little bit. Now, because we have 2 of each chromosomes and two sets and 23 chromosomes, if you think about the possible combination that you can shuffle the egg or the sperm into, that's over 8 million possible combinations, right? So no 2 eggs and no 2 sperm can never be alike. It's just not possible because they have to mix it up. Now, when they mix it up, now there's a process that splits and divides this round ball in the middle, divides it up in the middle, and then separates it. So now we are now reduced to separate chromatids, each one bearing only 23 as opposed to 46. So the take-home message is we have to shuffle the DNA, and then we have to reduce the DNA number. Now I'm going to show you a little movie of this in action. What I want you to see in this movie is, as a woman gets older, this process of reducing the chromosomes and dividing and multiplying, it's not as efficient, and I'll show you why. Let's just watch this movie. Well, it started a little earlier. So first I'm going to play it again. It probably went too fast and I don't know how to slow it down. So we're going to start with, let me pause it. So when you split the DNA up in the middle, each little side is pulled to one end of the nucleus. So this is where you split it, okay? You see these white lines that move things around? They start to fracture as a woman gets old. So you don't pull equally. So it's possible that some of the parts that are supposed to end up in this part accidentally end up in here. We call those genetic accidents because this process no longer is efficient, right? So I'm going to start it again so you can see how the cells are now about to do it all over again. They're going to divide again and split down this ball here called the centrosome, and you'll end up with 4 cells. So here it goes. See, and then you end up with 4. All right, so let's go on to the next slide. During fertilization, remember we now have 23 chromosomes from mom in the egg. It's going to mix with 23 chromosomes from dad, right? The 2 chromosomes meet up in the nucleus and they line up side by side, okay? They pair up. Now you have 46. But here's the interesting thing. You don't just pair up. Guess what? Nature is going to shuffle it again. It's going to cut some chunks from here, cut some chunks from here, switch it over, again, shuffling the deck. Now, if you think of shuffling the deck, what is the possible combination you can get when you fertilize an egg? It's 2 to the power of 46, right? I missed the 46 here. 2 to the power of 46, not 4. And I actually happened to do the math, not by myself, thank you very much. There's something called Google calculation. And you get over 70 trillion possible combinations. Do you understand? That's more than there are human beings on the planet Earth. That's why no 2 siblings can ever be 100% alike, because you're going to get this genetic shuffling. Now, when you get this genetic shuffling, there are obviously things that cut out the chunks, switch them over, and sews it back up. There can be accidents when you do that. So when it doesn't cross over very well. So the accident some of them can now become inheritable, and some of them can prevent the proper, you get a defective embryo that may not be compatible with life. Okay, so let me explain this in diagram picture. So now remember we had reduced that 23 to little strands We tore the strands apart, right? So we duplicated each strand, and then we tore them apart, and then we sent one strand from the sperm and one strand from the egg, right, to meet up to make 46. There are 46 sets of this now. In order to shuffle the DNA, to shake it up, each strand gets duplicated by itself. So you get this little tongue-like, fork-like thing. And guess what? This is the process I was telling you about, where you sort of exchange little pieces. So you get this piece swings over here, that swings over there, and you can get over 70 trillion combinations when you shake things up. Now remember, when you're shaking things up, there could be accidents, right? So maybe you don't quite shift the entire DNA packet that was supposed to go. So you end up with one extra bit of DNA on one side and one extra bit less on the other side. That can happen. Again, this just explains the process of how the DNA is mixed up, where you cross over, you see that, and sort of exchange DNA, shuffling the deck. This is a summary slide. You know, don't fuss too much if you don't get this. But what happens, we talked about, this is the sperm, the blue one, having these are the progenitor, the primary germ cells, the original germ cells. They have 46. The cell divides and it has to split this up to make 23 cells each. What it does is it duplicates each length of this DNA here, and then it splits each duplication up, so you end up with 4 arms. In the human egg, most of the genetic material and the cytoplasm, the rest of the cell, ends up with only 1 egg. The rest, it just contains the DNA. We call those polar bodies. They don't really contribute much, right? So is this one we track down. And this is what combines with a sperm cell to now reestablish your 46 chromosome, right? So a lot of musical chairs going on here, right? So accidents, there are lots of room for accidents to happen. And where they happen, we create what is called aneuploid cells, abnormal embryos that are just genetically so mismatched. And sometimes the abnormality may be so complex that the lab will tell us, oh, wow, there is complex abnormality. We can't even begin to figure it out. Now, sometimes this is a process of the division. When you now create a zygote, this is after it's been fertilized, right? The sperm and the egg has mixed. Now nature takes over. It's now going to break down this one cell into 2 cells, into 4 cells, and then 4 cells into 8 cells within 3 days, and then a rapid phase of division takes place. Now, this part, it's duplicating the DNA, tearing it apart into 2, separating it into 2 cells, surrounding it with cytoplasm, then doing it over and over and over. It's a very rapid process and a rapid rate of growth and division. In the initial part, if you were to separate these 2 cells right here, you could technically form 2 separate individuals, right? Because each cell can make a whole different human being. But you get to the point where the cells now starts to take on specializations, where each cell no longer just makes one embryo. It starts to now define the cell that's going to make the skin. It's going to be differentiating out into cells that's going to make, it's going to become, it's going to tell you what it's going to be. Now I'm going to give you a video to show you that process of division. Okay, look at it over here. So you can see how you have 2 cells, then 4 cells, and then 8 cells, just that rapid division. And then it starts to differentiate into specific embryo the part that's going to be the belly is going to differentiate. Let me, it went too fast for me. I'm going to stop it here. This is your phase of rapid division. The cells are growing very rapidly, controlled by the genes from the mother's machinery is controlling this division, okay? Now, I was going to, hold on, I'm sorry. Oh, wait a minute. I'm so sorry. Let me go back again, share. Okay. So, slideshow, and from current cells. Okay, so this cell is growing, this embryo is dividing rapidly. I'm going to pause it here. Hold on a second. Okay. Okay. Oh, I can't pause it. The embryo starts to divide rapidly, and the embryo starts to take on specialization. So now you start to form cells on the outer part of the embryo. See the embryo on this side forms a hole in the middle. That's called the blastocyst. This cell, this embryo, now forms what is called the blastocyst. You see the little ridge? I'm afraid of this disturbing the movie here. The cells around here will become the baby. The cells on the outside will form the placenta. Usually, one of the things that we can take advantage of is the DNA of the cells on the ring, on the outer part of the ring, usually can be the same complement as the cells that are on the inside. Those are the cells that will become the baby. Sometimes those are abnormal and they are different from the one on the outside. We call that a mosaic. How can you find the DNA of this embryo? It's very simple. You can biopsy the cells on the outside without really harming the cells that will form the baby, right? And then you can test if these cells are normal or not. Those are called using pre-implantation genetic testing to figure out which embryo is normal or not. Sometimes you could get abnormal, embryos. Let me just show you this. This is a normal embryo, right? This is what a normal embryo should be. The outer sac here should be the placenta cell, and this is the part that will form the baby, the one on the inside. Occasionally, you may have abnormal cells, and if they're mixed with normal cells, we call that mosaic embryos. If they are completely abnormal, those are called aneuploid. All right, so this is the end of my academic lecture. I can go back and review any part you want. Take home is that the DNA comes from mommy and daddy, and they have to be thoroughly shuffled to create a brand new individual, and there can be mistakes done in the process of shuffling that. I'm going to stop sharing there. And I'm going to entertain questions.
Wow. Wow, that was fantastic. I think the last time I saw that was in medical school. Fantastic. And the way you explained it was so easy. It's English. Because people wonder, why are some children born with deformities of any sort? Or, and stuff like that. And tonight we see why. So, is there any way one can prevent these accidents?
In truth, they are very difficult to pretend. You see, when I showed you those strands of DNA that pulled the chromosomes apart to the opposite ends of the nucleus and then the nucleus divides and you form two cells. As a woman gets older, those strands that pull the DNA, they're called the telomeres, those strands. As a woman gets older, those strands tend to break down. That's why when you look at the rate of abnormality, we call that aneuploidy. The rate of aneuploidy, the rate of abnormality, let's say in a 30-something-year-old, maybe 20%. But when you get close to 40 and above, that rate of abnormality turns to be 80%, right? So you get more defects, not because the DNA is bad or the egg is bad, but the machinery starts to break apart. It starts to break down. The machinery that pulls those DNA apart becomes defective. So it doesn't do its work as well. That's why the incidence of abnormality rockets up.
So I have another question. Growing up,
Yes.
I didn't see as many abnormalities as we see today.
But
is there a reason why that is the
yes.
case?
But you know, the vast majority of abnormalities are not delivered live, right? They just don't, they're not viable. So, and then if somebody has a miscarriage, I doubt that people were genetically testing them to see if they were genetically normal or not. So I could argue that back in the day, we just didn't have the instruments, we didn't have the wherewithal to actually test it. Who's going to test back there? They're not going to test to see which one is genetically abnormal or not. You'll just say, oh, that person never got pregnant. They had a hard time getting pregnant, right? But we wouldn't necessarily know what was wrong because it wouldn't have been tested for.
Because most of these accidents, so to say, actually abort spontaneously.
Exactly. The vast majority of aneuploid abnormal embryos, actually, they don't live long. Aneuploid embryos make up 60% of miscarriages. And most of them, 30% of human pregnancy is wasted. We call it a genetic waste. But majority of those are not even known, even by the patient. Because if the person miscarries within the first 3-4 weeks of life, they just go ahead and have a normal menstrual cycle and they wouldn't even know what happened. Unless you had a beta HCG and then you notice, wait a minute, you had a beta HCG one day and then the beta HCG is down, it's plummeted or it's now 0. So you just wouldn't know. The vast majority of aneuploid do not survive. Most of the aneuploid that do survive tends to be like Down syndrome. But then majority of Down syndrome infants, 80% of Down syndrome pregnancies actually spontaneously miscarry. Now, if you have a situation, I'll give you an example. There's something called trisomy 7. That is where, when the chromosomes were supposed to pull apart, well, it didn't. So one cell got an extra chromosome, one cell was missing. That extra 7 now fertilizes with a normal 7 chromosome. All of a sudden, you end up with 3 sets of 7 that was never meant to be. Those embryos will implant. You'll see a beta HCG show up. They all will not survive beyond 7 weeks of pregnancy. They just won't. So, and unless the products of conception was genetically tested, you would never even know. So when someone tells me that they had a miscarriage and they're trying to get pregnant, the first question I asked them was the products of conception tested for genetic evaluation? Do we know what the genes were, right? So, I could tell the patient, look, if you have trisomy 13, that will never yield to a pregnancy. Now, is it inherited? No, it's not. Those are what we call genetic accidents. They're not inherited. They just happen at random. They can happen to anyone. And so I always tell patients, it's not anything you ate, drank, sat down, didn't sleep, jumped up and down 20 times when you were, no, it simply was going to happen. I'm sorry, does that answer the question a little bit? I tend to wax too much.
It did. It did. Thank you.
Thank you so much. That's a question that I wonder. But first, there's a hand up. So yeah, Dr. Jabi, yes.
Hello. Thank you, Dr. Famuyiwa, for your presentation. I know that you're talking more primarily on genetics, but how about those nutritional deficiencies that do affect the outcomes of pregnancy? Could you explain some of those?
So did you see that movie I showed you of the rate at which that those embryos were growing? You see how rapidly you have such growth? When you have such rapid cell division within the confines of the uterus, it's happening within the environment of whatever the mother is consuming, of whatever she's exposing herself to, right? So when you're rapidly dividing, separating DNA, shuffling it up, pulling it apart, dividing, things can influence, either by solution, radiation, whatever, those mechanisms responsible for properly dividing the DNA, fixing it. And by the way, the cell division is not perfect. So there are fail-safe mechanisms to fix DNA damages, to fix the fragments, to add telomere lengths, we call it, to the DNA, so that otherwise, we'll all be dead within, you'd rapidly age and die in a few years, right? So there are mechanisms set in place to help edit and correct. Now, and some of those are what we call antioxidants. So if you eat a lot of fruits, for instance, kiwi, pomegranate, name it. Most fruits, especially colored ones. I think we had a lecture on food the last Medical Mondays where we heard about healthy foods. Those are things that aid that help to supplement your body's mechanism for fixing problems. When you consume unhealthy stuff, or let's say you're exposed to radiation, you deplete the body's ability to properly edit and correct. And you may end up with more problems than not. So that's where that would come in.
Yeah, well, the reason I asked that question is has to do with babies with anencephaly, spina bifida,
right.
facial clefts, and all of that stuff.
Yes.
I know that we usually tell them, the mothers, maybe because they lack folates when they were in pregnancy early enough. And those are the kind of things I'm trying to elucidate, that they're not necessarily genetic, but there are environmental factors that do affect the pregnancy outcomes.
Well, we all have, I'm sure, most people have heard about babies that were born when their mothers ingested DES, right? So you end up with some birth defects because it affects the process while that embryo is rapidly dividing and the cells are becoming specialized. So you affect certain cells in there. It's the same process while we warn women, if you are taking Accutane or any of its derivatives, you must let your doctor know to stop it before you get pregnant, because it will affect that division process, that specialization process. And when you get cells, maybe I should show that movie again. At the level of the blastocysts, the embryos become specialized. They become specialized. So you can't fix it once they're specialized, right? Before they are, and if the insult happens before specialization, you might just simply kill off the entire embryo. Let me show you again. So you have an embryo here, and you can see it's about to divide in. It's been fertilized. You see the pronuclei here, and it's going to rapidly go through the division. That's a lot of activity for this cell to do. This is a time lapse, and this happens within 5 days. This number of division, that's very, very rapid. So now imagine inserting a toxin in this. You could affect the process and affect the cell's ability to make corrections in there.
Well, thank you.
You're welcome.
Tawa, please unmute and ask your question.
Good evening, everybody.
Yeah.
I don't know how to even put this question. They said men are determinants of sex of a child.
Correct.
Okay. What happens to the hermaphrodite?
So you are talking, now that's a complex issue. You're looking, and maybe we will do a presentation, because I'm stopping the development here at the blastocyst stage. Now, this embryo continues to specialize, and there are certain things that need to take place. For instance, there's something called the urogenital ridge, right? That is common to both boys and to girl embryos. And certain things need to happen where you have the structure that becomes the uterus in a boy is supposed to now regress, right? And becomes almost infantile, where you don't even notice it, right? So the apparatus that forms the uterus, the fallopian tube, is supposed to regress and go away. If that doesn't happen, you may have a remnant there. So, that's a whole different lecture. So those are accidents of either inability to regress whatever should regress, or inability to activate certain things that need to activate. And there are a whole host of things that could happen, all the way from a woman that doesn't have a uterus, we call that uterine agenesis, to someone having two horns, because the two horns that formed it did not merge properly. Or they may have two vaginal, they have a septum in the vagina, and the septum can go all the way to the top of the uterus or not. So a whole host of things can happen. For instance, if you have someone who the testicular tissue is in the inguinal canal, for instance, you may hear your doctor say, well, that person needs to have surgery to have it removed because they have a tendency to form certain cancers. So that, you're talking about development of the embryo, and maybe we'll do that next time, but a whole host of things have to happen before you properly form either male organs or female organs. And sometimes when you expose a baby in utero, say to steroids, or I'll give you another common example. There's a genetic disorder where they have, it's called 21 hydroxylase deficiency, where they don't inherit the gene to properly process steroid hormones in the adrenal glands. So the adrenal backs up and makes excess androgens, right? You can correct it in utero, but if you don't correct it, a female born will come out with a phallus, right? And it looks like a proper phallus, because certain things that the androgens that were not supposed to be present at the time of development of the genitals was there and resulted in the phallus being happened. So sometimes those infants are actually raised as boys, and the remnant testicular tissue is removed to prevent cancer. So when you have what we call ambiguous genitalia at birth, I know everybody's standing around the delivery table. Oh my gosh, is it a boy? Is it a girl? What is it? The best answer at that point is not to give an answer until that child has been thoroughly evaluated to determine what is going on before you now assign a sex.
Yeah.
Thank you very much.
I just wanted to, interject a little bit here. When Dr. Famuyiwa was talking about, the testicle in the inguinal area, when you have a child that is a boy and the pediatrician is trying to feel the testicles to make sure that they're both there, they use the word descended.
Correct.
To make sure that they are in the scrotum. That's what she's talking about. If it is not there, if the testicle did not descend into the scrotum, the pediatrician now raises a concern and, asks that the child be sent to neurologist, that they should, remove that testicle that did not descend, because in the future, it will become cancer. So I don't want us to miss anybody there when we're talking about inguinal area. And,
I'm sorry, forgive me.
No, don't be. That's why I'm here to back you up.
But that's a fascinating topic. And I think that deserves a separate conference of its own, because so many things could happen to the genital organs.
So all those tests that pediatricians do, and they're looking for Babinski sign, they tapping the foot, the plantar aspect, of the feet to make sure that the baby makes a sign like this with the foot. Is checking the nerves in the brain, stuff like that. All those tests that they do when the baby is born is to check different things, to make sure that these accidents had not happened. Because some of them we can actually, do things for, but some we can't. You just know that this is there and know which way to deal with it.
Thank you so much. We already have questions in the chat box, but can radiation, X-rays, MRIs, or aberrant gamma rays create the inbox errors?
So I don't know what you mean by aberrant gamma rays, but we do recommend that, let's say you have pelvic cancer or cervical cancer that's about to be radiated, then the ovaries are certainly protected by rotating them out of the plane of radiation to try to protect them. Most of the time, the damage you cause is simply just destroying the ovary, so that you just, remember I told you that you don't make new eggs. So if you radiate what you have, you simply kill them off, and it's hard for them to come back. So they certainly make all effort to try to protect the genitalia when radiation is being applied. But most of those defects is simply, it kills it off.
Thank you so much. There's a question in the chat. Please, does fibroids prevent pregnancy in women?
That's a very, I know we had a previous presentation on fibroids. I'm sure you guys can go to Dr. O's YouTube channel and pull that up. We dealt with that in detail in that presentation. Fibroids are a complex issue. It depends on where it's located in the uterus and how big it is. So it's that the answer is neither yes or no, because it all depends on the location, and the size of the fibroid.
Thank you so much. What tests can you get before pregnancy to help you find out about genetic conditions that may affect your baby?
Okay, so now remember, if you don't, I will go back again. We discussed accidents that happen as a process during the process of normal division that now creates a mutation, right? By putting in wrong DNA. Think of your Lego blocks. You didn't, you misplaced the block, or you put too many blocks in one strand. Those are they're not genetically inherited. Those are accidents in the process of division. Now, when you are talking about tests you can do before you get pregnant, what they're simply looking for is to see if you are a carrier of a particular disease, say sickle cell, cystic fibrosis, Tay-Sachs. That's different. That is caused by a mutation in a specific location on the chromosome that transmits so that you now produce an abnormal protein. And because you have two sets of chromosomes, remember we talked about mommy and daddy? Let me show you this set again. Let me show you here. If you have a mutation, let's go over here, show you the slide over here. If you have a mutation, say, in the middle of this strand, remember, you inherit two sets of chromosomes, one from your mom, one from your dad, right? And if that mutation is called recessive, that means it's not going to do anything because, think of it as if you have a V6 engine, right? Except engines probably don't work that way. You have three sets on one side, right? I guess the engine doesn't, because I guess if one cell doesn't work, the engine is knocked out. But in human beings, as long as you inherit one that's normal, you won't express the disease. However, if daddy is a carrier for, say, Tay-Sachs, and you now mix it with DNA from mom, who also is a carrier for Tay-Sachs, when you mix them up, you have a 25% chance of having a normal child, 25% chance of having a fully affected child, and a 50% chance of having a carrier. That's why they recommend that you do the testing before you have. In fact, the American Congress of OBGYN recommends, I don't have a diagram showing the pathway explaining how you inherit that. Maybe I should have. But you don't want to end up with a fully blown affected child for something, say, like Tay-Sachs. Why? We know Tay-Sachs is universally fatal, right? So you want to avoid that. And I just gave you an example before we started about congenital adrenal hyperplasia that causes androgenization or too much male hormone in a female fetus, right? And once that effect has been done, you cannot reverse it, right? So you can't treat the baby in the uterus nowadays to even prevent that baby coming out affected. So you can still deliver a normal child, but you need to know about it before it happens so it can be properly treated. And if it cannot be treated, you may choose to say, well, I don't want to have an embryo that's going to die, right? I choose not to. That's why they recommend that really anyone trying to get pregnant, with all the technology we have in today's age, it should not come as a blind surprise when a child is born in the delivery room, affected with any number of the inherited diseases that we know about. We know about these things. It shouldn't hit us like a blind spot. We should see it coming like a rushing oncoming train in a tunnel, right? That's why they advise you to get tested.
I just want to bring it home closer to us. Sickle cell.
That's right.
The question in the chat that says, what tests can be done before pregnancy? Sickle cell is a good one. Before people get married, It's a very simple blood test to know if the partners are carriers. And if they are, each pregnancy has the potential of producing a sickle cell child 1 out of 4 times. Correct, Dr. Famuyiwa?
Correct. Absolutely. Absolutely. And the funny part about it, in the olden days, you get pregnant, they quickly screen you for sickle cell. Nowadays, you can use your saliva and screen over 300 inheritable conditions. Now, they may look like esoteric tests until you get 2 people positive. I test almost all my patients get tested. In other words, I offer the test. They have the right to decline, and people do decline. I'm not going to choke it down their throat, but I offer. And I can't tell you how many number of times it comes back positive, and I'm surprised. I guess, in Nigeria, we say that it's not written on your forehead. You can't look at the forehead and go, do I see the genetic code for, you can't tell. And, people say, well, we don't have that in my family. My great-grandfather, my grandmother raised me in the village and nobody had that in our family. That's because it's recessive. It's recessive. It does not manifest until it's partnered with an equally recessive partner. Then you have a full-blown effect. Then you have the tragedy of dealing with something like that. That could potentially be fatal. And it's, I remember to this day, a gentleman came to my, he and his wife came in, and he told me that he doesn't remember what his baby sister had, but all he remembers is that when she was born, she had a genetic problem, and he watched his parents suffer for 3 years back and forth until his sister died at age 3. And he was young, and he had to witness this, and it broke him. It broke him. So he said, I don't want to go through that. I saw what it did to my mother. I don't want to go through that. Does that elaborate the question a little bit?
He did. He did. And, this is a very, very important subject, because I see a lot of our people who will not test.
Yes.
They will tell you, it will not be my lot in Jesus' name.
That's right.
They won't. And these things are simple. Look, you love somebody, you decide to still go along with marrying this person. At least you'll be going in with your eyes open.
Wide open.
And there'll be no surprises. It is important to test, at least what we can test. Those accidents still happen, regardless of what you do, diet and all. Dr. Jagwe is right, when he pointed out diet, and that's why we give prenatal vitamins, for instance, and a lot of folic acid when women are pregnant. But, accidents can still happen, but they tend to, help to not let them be as common. But it is important to test. And this goes beyond even genetics. If you are done with childbearing, you still have children, you have grandchildren. And so this subject is very, very important. Dr. William Craig has a question. Can you ask your question, please, sir? Yeah, I'm asking you to unmute. Dr. Bill, there you go.
Okay, unmuting. Which question is, well, there's one about the prenatal vitamins. We have so many variations in the marketplace right now. Is there a prenatal that you prefer and or recommend?
Yes, absolutely.
To women? Yes, what?
I like the Theralogics brand.
Okay, serologic.
Thera, T-H-E-R-A, Logix, L-O-G-I-X. And they make one called the core vitamin for women younger than age 35. For anyone 35 or older, or anyone that we know has a low egg quality, we recommend the OvaVite, OvaVite. It's part of the Theralogic brand. You might want to have it prescribed to you. You can get it, but you'll pay more for it without a prescription. And the OvaVite adds the CoQ10 to increase the amount of antioxidants. I like this particular brand because it has the highest vitamin D of all the vitamins that I've seen out there. So when patients come to me and go, I got this brand, and I go, yeah, I don't look at bottles when I look at vitamins. I look at the ingredients. So I look at, what is in there. And I tell them, look, here's the ingredient for OvaVite. Here's the ingredient for core vitamin. Put it side by side. You do the math. You see for yourself. A lot of them do not have adequate vitamin D. And especially the over-the-counter ones certainly don't have enough folic acid. They can't go past 800 micrograms because they have to go through FDA clearance. And it's a lot cheaper just to put on a fancy bottle and sell it. Why should they bother? FDA is going to ask them to do all these kind of tests. Those cost money. Well, I can make a fancy bottle and sell it on, eBay or Amazon or whatever and make a killing, right? So I like OvaVite and core vitamin. And when you get pregnant for our patients, we switch them to the complete, right? Which even adds more vitamin D to it. It adds the DHA. So my patients go from core or OvaVite to Theranatal Complete. So the brand is Theralogics. They make Theranatal, Natal, core vitamin, or Theranatal, OvaVite, OvaVite. And then when they get pregnant, I switch them to the complete.
Excellent. Another question, if I may?
Yes.
Had a patient, young patient, infant child, who had MSUD, maple syrup urine disease, who was born with it. And we had a problem in terms of failure to thrive until it was discovered that this child had this disease. At what point in the maturation process would that have taken place or developed? Was that, it was the first time I came across it, of course. But
I'd have to look that up particularly for you. I don't want to put my foot in my mouth. I like to research my topics. I would have to look it up for you.
Okay.
It depends. Did it happen? Is it an enzymatic cause? Did it happen during the formation of the genitals? I'd have to look it up specifically for that.
Sure. Thank you.
You're welcome.
Yeah, what's a maple syrup disease? Never heard of that.
It's a disease where the child's or the individual's ability to produce a particular enzyme which will allow them to break down what's in the food. So as a result, they don't have this ability to break this food item down or this nutrient down. So they develop a response in terms of, usually it shows up as a stomach distension, huge stomach distension, and the child is not thriving. So it's I say it's a rarity. It's really a rarity at this point. But
it's a genetic disease too.
Yes, it is. Yeah.
So it's inherited. So if you know, for instance, maybe the parents didn't know they were carriers, that can, if it can be tested for. And if mom and dad are carriers for it, you can actually have PGD done. And I know I'm not elaborating on PGD. That's pre-implantation genetic diagnosis, where you can develop a probe for the defect in that gene and test the embryos before pregnancy. So you can, that's beyond just looking for aneuploidy, which is just testing, just trying to catch any abnormal mixture of the DNA. Mm-hmm. When you have a specific genetic mutation, in this case, you can develop a probe, and they can use that probe to test the embryos. And when they develop the probe, they usually get blood work from any available family member. So they will get it from the parents for sure. But sometimes, like I had a patient whose parents were in India, And the genetics lab, they actually sent a requisition to India to have blood drawn on available family members so they could track the mutation and develop an accurate probe to test the embryos before we transfer. That can be done.
Okay, so pardon my medical ignorance. So it has nothing to do with drinking maple syrup, because that kind of scared
Not
me.
at all. It's a genetic, it's inherited. It's genetic. It's
Okay,
genetic.
all right, thank you.
Excellent question, Auntie Lara. Excellent question.
Actually, the urine smells like maple syrup. That's why it's called that.
Yeah. Yeah. So we have Auntie Tower. You have your hand raised. Go ahead, ma.
Is there any danger doing amniocentesis during pregnancy?
Well, the funny part is we've gone beyond amniocentesis, right? So amniocentesis is now, if you ever watched Flintstone, the movie that we used to watch when we were kids, that's like almost in the Stone Age nowadays, right? Because now they have what is called non-invasive prenatal screening, NIPS. So why is that? The baby, as it grows and forms a placenta, that placenta is intimately interwoven with the uterus, so that there are actually spaces where mom's blood and baby's blood do mix, actually. And there are certain cells. It's like, when you shed your skin, we all do. You shed skin cells. You may not know it. You shed your skin. You may notice you shed more of your hair, but you shed. Everything in your body sheds. Your buccal orifice sheds. Everything sheds, right? So the baby sheds cells into mom's blood. So guess what? They can now test mom's blood, separate out baby cells from mom's cells, and run specific cells on the baby cells. So we can actually get some of these answers prior to you need amniocentesis. That's one. Amniocentesis, you get where you have a big amnion, so you have to wait till you're like, at the earliest, maybe 16, 18 weeks of pregnancy, sometimes 20 if you don't have a lot. So that's almost too late to be making a diagnosis. You can test the embryo itself before it goes in. You can test it before the mom even knows she's pregnant, because she's going to shed cells. And there's now a company called Cradle Genomics, shout out to Cradle Genomics, where they can actually even, they put like a cup, a menstrual cup in the vagina. And guess what? The growing embryo sheds cells that comes through the uterus, down through the cervix, into the vagina, and they're now perfecting ways of isolating the baby cells from this. This is even before you're clinically pregnant. So there's a lot can be done before you get there. And then, you can, and if that fails, you do what is called choreo, a CVS biopsy, where you biopsy part of the placenta before you even get to where you need the amniocentesis, choriobilon sampling, right? CVS. So those can be done around, say, 12 weeks of pregnancy. But usually with technology nowadays, you can actually do most people, when you go for a prenatal testing now, around 8 weeks, 9 weeks, when most people discover they're pregnant, they order these tests for you way ahead of time. And you can get a lot from this. So you have option to test before you get pregnant, right? Pre-implantation genetic testing, or if you have a mutation, you can do a diagnosis, or you can test when the embryo is still growing, and so on and so forth. So there's a lot that can be done nowadays.
So Sister Lola would like to know if you don't mind mentioning the name of the prenatal vitamins again, please.
Can I'll cut and paste it into the chat.
Thank you.
Neonatal core.
And Dr. Jagbe, thank you for that link to maple serum urine disease.
Where's the chat function here? More chat and theranatal core, theranatal ovovite. Sometimes it listens to me, sometimes it doesn't.
Technology.
Core.
I think it's ovovite.
And then you have
You are on the Medical Mondays with Dr. O. You can get us on YouTube where you can catch up with all the old episodes. There was a question about fibroids and fertility. Dr. Famuyiwa has already discussed it. On this channel, you can get it on YouTube, Medical Mondays with Dr. O, and you can get all the interesting discourse that we've had over many health-related topics. Remember to hit the like button and subscribe so that whenever we go live, you can join in the conversation and get to know more about things you need to do for you to have a better life in line with our mantra, strong health, strong future.
I'm so sorry. I think I direct messaged someone. I should have sent it to everyone. So there it is.
Just copy it and then paste it.
Yes.
There you go. Yeah. Sister Lola, did you get it? Great, she did. She did. Any other questions?
Thank you very much. I want to come in with a comment and also to ask one thing that you said. I heard you mentioning basics and whatever.
I'm sorry, say that again.
As I heard you mention basics, talking about engines. I mean, type of engine. Yeah, so
I guess that was not such a good analogy.
No. It was okay. It was okay. The V6 is the style the engine block is built. It's built in a V shape, but then it gives the manufacturer or the designers more room to add more cylinders.
Awesome.
Now, we talk about cylinders. Sorry, I'm going into a little engineering now. So when I talk about cylinders, you talk about number of cylinders that allows the particular automobile to develop the power to do the work that it has to do.
Right.
So the more the engines or the cylinders you have, the better the performance. In other words, you say it gives you more room to have horsepower. And when we talk about horsepower, one horse can run really well and fast, and can also pull huge load. So the more you have, the better it is for you to be able to do more work. I'm just trying to bring this up because when I heard you mention that, I'm like, that's good. So
I guess your basics is we've got two, one from mom, one from dad.
That's right. So in your case, you're talking about just mom and dad.
Yeah.
Besides the number of cylinders we're talking about, and the style, the V shape or the L, the inline, which is called the L design. I mean, the L design is a straight line. It doesn't give you room to add more cylinders. So of course, we have what we call the two-cycle cylinder or two-cycle way of performance, and then we have the four-cycle. Now the two-cycle, when we talk about two-cycle, sorry, I'm just bringing a little bit of engineering here. So when you talk about two-cycle, you are talking about missing so many things at operations at the same time. Now, when we talk about four-cycle, we're talking about the intake, the compression, the combustion, and then the exhaust part of it, which gives you the power, the combustible power. Now, I know you talk about just mom and dad, but here we're talking about 2-cycle or 4-cycle. I don't want to go.
I know, like I said, it was probably not an appropriate analogy, but now we know more about cars.
No, but I think it's good because the more cylinders we have, the better the refinery and the more the power to do the work that you want to do. Thank you very much. Anyway,
thank you.
Everyone, thanks for allowing me to just say a little bit of engineering stuff here. That's it.
Thank you.
Thank you, AJ, for your comment. Your comment are welcome. You can drop them in the chat box, or you can raise your hand electronically, and then we will call you to ask Dr. Famuyiwa all the questions you have.
So I have a question, and this is a little bit of a deviation. Say somebody now ends up with a child with disability, because we say they have disabilities because of these accidents that occur, and they can't handle it. So what resources would somebody like that have, at least in the US? I don't know about Nigeria.
Somebody with what?
They have a child that has disability.
Correct.
What resources would they have if they feel that they cannot handle taking care of such a child?
That's a good question. I mean, I do know that there's, you'd have to go through your social workers, but there are arrangements for such kids to help them. And most social workers can help you. Usually at birth, the pediatricians and the hospital will reach out to help. So there is ample support for those infants.
Thank you.
Thank you so much for all the knowledge that's been shared. It's been a very wonderful conversation. And that leads us to our Medical Monday moment.
Ooh, Medical Monday moment. Well, I just want to thank God that we're here. It's Thanksgiving week.
Yes.
And we still have people who are still eager for knowledge to participate. A lot of people travel. They're traveling right now, to different places to enjoy family, like Dr. Sandu. But here we are. God has still kept us alive and healthy, despite COVID. Since 2020, can you believe it? They said the numbers are surging again. Australia is closing down. I think we're masking up again in Maryland, somebody told me, since I don't hear the news that much anymore. But all in all, the Lord kept us safe. So I am just grateful to God. I don't know about you. I thank God for life. I thank God for every single one of us. And I just pray that the Lord will continue to keep us safe. And through Thanksgiving, I want to encourage us to be mindful of the fact that COVID is still very real. If you're not vaccinated, please consider doing so to get vaccinated. And even when you're vaccinated, still please be safe. Maintain those physical distancing, wear your mask when it's necessary, and avoid crowded places where there isn't room or air to breathe. So that's, I just felt like I need to share that because we're going into Thanksgiving and so much is happening with COVID.
Yes.
So on this forum also, we give gifts to people who bring 10 people or more. We'll invite them and they show up. And or, we've had a champion so far, Dr. Ajagbe, who brought more than 20 people.
Wow.
One during one of our forums. So tonight, happy Thanksgiving. I didn't see anyone who contacted me that they brought 10 people or more last week. So we're not going to give anything this week. We look forward to next week. Dr. Sandu will be coming to cook next week. I sent the recipe. Did everyone on this forum right now get the recipe?
I didn't get any recipe.
Yes,
In the email.
I got it, yes.
You got
Yes,
it?
I have it.
Fantastic. So I'll make sure you get it, Dr. Famuyiwa, but it was sent by email and I'm going to resend. She decided that because she forgot that she has a family trip this weekend, this last weekend, I think Friday or Saturday, and for the week, that she's going to cook 2 things. We're going to have 2 meals prepared. I think both the millet and the quinoa. I am looking forward to that. And I hope everyone is looking forward to that too. Get your pots ready and we'll be cooking next week. And guess what? After that, I think we're going to exercise on this forum. There are many people who don't even know what exercise, how to do it, and look forward to some fun times on Medical Mondays with Dr. O. We're going to learn some neat things.
Absolutely.
Dr. Jagbe raised his hand. You can go ahead, sir.
Yeah, I was just thinking, based on the topic for today, the issue that was raised is genetics, infertility, seed or soil. I'm trying to figure out what happens to children who are, people who are Down syndrome. Are they able to have normal offspring, or they are destined to not having any offsprings at all? What is it?
Because they have trisomy 21, right? If they were to have an offspring, theoretically, you could test any of those of embryos to see if the genetics of the resultant embryo is normal. So as long as they're able to get just 2 pairs of chromosome 21, they should be okay. But if they don't, then there are ways now where you can test it.
Thank you so much. There's another question in the chat. How does thalassemia affect an individual?
Thalassemia, you talk about alpha thalassemia? It's a genetic abnormality in patients almost similar to sickle cell, except it's alpha thalassemia. It's a milder form. So they don't sickle or go into crisis like sickle cell patients do. So it's usually a milder form. And most of those people do just fine.
There's another one. Are there any current studies on sickle cell traits, the symptoms and asymptomatics?
Are there, say that again?
Are there any current studies on sickle cell traits?
There are a ton. In fact, a lot of universities even have dedicated sickle cell centers. And I tell you right now, Howard University has one, probably one of the biggest, because they want to study it in minorities. So the NIH is currently doing, there are a ton. All you have to do is Google it or go to the government website to see where a current one. I'll even Google sickle cell centers, and I know for sure that Howard University has one.
Thank you so much. Before we go, Dr. Famuyiwa, your final words on the topic.
So for me, this is a topic that's intellectually stimulating for me. It's fascinating for me. So I guess it's a selfish topic for me because I like it. I like it. I did know how well people receive it, but this is what I love. I love doing it. I love delving into it. To me, it's like a puzzle, a riddle, and this is what I solve all day. And it's fascinating and fulfilling for me. And if I can share that knowledge with my patients and help them have healthy babies, all the better. But this is just I love the science behind medicine. I didn't even go into as much depth as I normally would if I'm teaching residents. I do teach OBGYN residents and medical students. And in those cases, I go even deeper into the molecular aspects because it's intellectually stimulating for me. It's, you never seen people who fumble with a Rubik's Cube and they can't stop. This is my Rubik's Cube. I love it. It's interesting.
Thank you so much. And thank you all for joining. It has been a stimulating conversation and an eye-opener for me personally. The topic that has been treated, many things we take for granted, but there is a science behind that, and things don't just happen for happening's sake. So it's been a very good discussion. You've been listening to Dr. Oluyemisi Famuyiwa, a fellow of the American Congress of Obstetricians and Gynecologists, and we have been talking about genetics and fertility, the seed or the soil. We appreciate your joining in this evening for this discussion. We continue our mission to inform, educate, and inspire and empower you with the medical information and more. This includes fitness, nutrition, health and wellness, lifestyle boost, and joy, peace for your soul. Remember to share the Medical Monday links. You can join the Facebook discussion, or you can also get us on YouTube, Medical Mondays with Dr. O, and you can catch up on all the previous educative episodes. Until we come your way, same time, next Monday, my name is Gustav Ajay on behalf of Dr. Toyin Okwesami and the Medical Mondays with Dr. O. We love you all. Let's meet again.